Hi, I'm Claire Lyon, and I'm going to go ahead and do the sinus trigger today. So I'm going to grab my patient. Hello, can I get your first and last name?
Maritza Pantana.
And your date of birth?
5/20/94.
Perfect. Any chance of pregnancy today?
No.
Okay, and what brings you in?
I've just been having pain here.
Okay, sounds good. So I'm not going to give my patient a gown because we're just going to be working on this goal. But I am going to have her put this shield on. I'm going to put it on backwards for now, just to protect, since she is female, to protect her chest and her reproductive system. First image I'm going to do is the lateral sinus. So I'm going to have my patient come and stand over here, have her be in an RAO. So she's just going to slightly oblique her body and place the right side of her face on this cleaned bucky. I have my tube set at 40 inches, and I'm going to and then I'm going to adjust my central ray. Oh, there we go. And I'm going to have her take a step back. Perfect. To be 1/2 inch to 1 inch posterior to her outer canthus. We're also perpendicular to her inner pupillary line. And I'm going to place my right marker up here, out of the way. And we're just coning down a little bit about the glabella to the acanthion to include all the sinuses. So in this, our mid-sagittal plane is parallel to the IR, and our IOML is parallel to the front edge of the IR. The technique I'm going to use is 70 at 4, and we are coned down, but you could use an 8x10 for this projection. Go ahead and hold your breath, X-ray, and breathe and relax. Okay, so for the next image, I'm going to do the Caldwell. So keeping my tube perpendicular to the IR, I'm going to have my patient just place her nose on the IR. So we want to create a 15-degree angle from the IR. For this image, we are exiting the nasion. Okay, that looks good there. And I'm going to place my left marker in the light field. So we'll go down there. So again, 40 inches, we're horizontal and exiting the nasion. We have a 15-degree angle with the OML. Our nose is on the IR and our mid-sagittal plane is perpendicular to the IR. I would use a technique of 70 at 10. Go ahead and hold your breath, X-ray, and relax. The next projection that I'm going to do is the waters. Keeping at 40 inches, I'm going to have my patient continue to face this direction, and we're going to place just her chin on the bucky this time, creating a 37-degree angle here with the bucky. Okay, and we're keeping my marker in the light field. It's good there. So for this one, our chin is on the bucky with the mid-sagittal plane perpendicular to the IR. Our OML is 37 degrees angled from the plane of the IR, and our MML is perpendicular to the IR. My technique is 70 at 12.5. Go ahead and hold your breath, X-ray, and relax. And the next projection that I'm going to do is the SMV. So I'm going to have my patient turn around and face the tube. I'm actually going to grab a stool and have my patient sit. And you want to walk that around. And I'm just going to have her bring her head and her chin all the way back. Perfect, a little bit more. Good. So we're centered in between the mandibular rami. We have our central ray 3/4 of an inch anterior to her EAM, so I might have her just come up just slightly. Perfect. And I'm gonna place a marker in my light fields. Right there. For this, we're horizontal and perpendicular to the IOML. At the mid-sagittal plane, we're 3/4 of an inch anterior to the EAM. Our mid-sagittal plane is perpendicular to the IR, and our OML is parallel to the IR. And for this projection, we are doing the closed mouth. I'm going to use a technique of 70 at 16. Go ahead and hold your breath, X-ray, and relax. And that is it for my sinus trigger. For the lateral sinus projection, we have all 4 sinuses demonstrated. No rotation of the skull. We can see this by the sella turcica being in profile, the orbital roof superimposed, and the mandibular rami superimposed. The PA axial projection using the Caldwell method shows the frontal and the ethmoid sinuses. We want to see the petrous ridges lying in the lower 1/3 of the orbits. We want to see no rotation in the skull, and we can see this by the lateral borders of the skull and the lateral borders of the orbits having equal distance, and the petrous ridges being symmetric on both sides. You also want to see the mid-sagittal plane of the head aligned with the long axis, the collimated field. For the parieto-acanthial projection using the Waters method, we want to visualize the maxillary sinuses. We want to see no rotation of the cranium. Again, you can tell this by the lateral borders of the skull and the lateral borders of the orbits having equal distances. We also want the orbits and the maxillary sinuses symmetric on each side, as well as the mid-sagittal plane of the head aligned with the long axis of the collimated field. We want the petrous ridges lying below the maxillary sinuses. For the submentovertical projection, or the SMV, we want to see the mandibular condyles anterior to the petrous ridges. We also want to view the sphenoid and the ethmoid sinuses. We want to see no rotation of the skull with the mid-sagittal plane perpendicular to the IR. We want to see equal distances from the lateral border of the skull to the mandibular condyles on both sides. We also have the IOML positioned parallel to the IR. And we can see this with the superimposition of the anterior frontal bone by the mental protuberance. And we also want to see, again, the mandibular condyles anterior to the petrous pyramids.